Can you confirm or deny that the health system in Papua New Guinea is really failing the people of Papua New Guinea?
The health system has not failed. Yeah, health system not failed. Health system not failed.
No money, no medicines. They are sending patients away. That has never happened before. Therefore, today the system has failed.
To the Kusub hospital, right away, so that that hospital can operate and serve the people of Chiwaka. Number two, I think in 2021, there was a groundbreaking or launching of five-level hospital, provincial, Chiwaka Provincial Hospital. And it's 3 or 4 years ago now. And are you going to build that five-level hospital in Chiwaka province? Because since Chiwaka got its separate province, it's 13 years old now. And the national government is not doing anything for the people of Chiwaka. And that provincial health hospital was launched some years ago, but it's not happening. And I am asking the minister if you can build that level 5 hospital for the people of Chiwaka. And my third question is, there's a lot of rumors going around that your health system is failing the people of Papua New Guinea. Can you confirm or deny that your health system in Papua New Guinea is really failing the people of Papua New Guinea? Thank you, Mr. Speaker.
The Honourable Minister for Health. Thank you, True Long. To you, Deputy Speaker. No, thank you, Long. Memablo, not wagi. Lots of very, very important question. Me go along National Hospital 3 weeks ago. Na me meet one them kudla online work lo have. The Chief Operating Officer, Dr. Ben, me looks available work will make him. And then CEO of Churchill Services, Mr. Joseph Sika. I actually was there 3 weeks ago. It's one of the best health facility, I can say that, in the entire Highlands region, and compared to many of the facilities that we have as a government runs to him, although working big walk through. There was a Department of Health team that went last week, making full accreditation, determining whether the hospital by serving some full level 5 or NOGAT. And I want to say today to the people of Chiwaka that it actually achieved the perfect accreditation as now the level 5 provincial hospital serving people of Chiwaka and the country. So congratulations. A certificate will be given to them very, very soon. Come back to your question. First one, the 5 million kina now requested. I'm got the Luxave and it's on the everywhere on the social media. I can confirm that Chiwaka PHA funding belong online long Nazarene is go through long budget but Chiwaka PHA on a yearly basis. That's something I look along and now you look at some Chiwaka PHA receives among the highest amount that goes to all the PHs every year. This year only big money. To date, 70%, 60% of the funding you go to Chiwaka PHA or Kisimpinis. Olan Nazarene, Kuchip Hospital only request him 7 million kina low operational funds blow long this year. Just 7 million kina. Out of the 7 million kina recovery so they only received 1.7 million kina. So this last now shortfall of something or this of him. So we look. I'll be having a meeting with the team, management team we see in Port Moresby. I'll have a meeting with them today. I want to say today we have identified the funds and we'll make sure that the funding will be paid to them this week. That 5 million kina this week because we have identified the funding. Actually, we will want to increase that funding. 5 million kina running 248. So 248. Sorry, 148 beds in Chiwaka. The hospital is actually having that's 55,000 annual attendance outpatient. 55,000 outpatient attendance this lausik. People through 2,500 deliveries every year and people too. And then 7,000 admissions every year. That's for a big level 5 hospital. And we meet them over the requirement. And to have a hospital where we run one time even now, they're requesting for only 7 million kina, but we give, according to the system or report recording like Kisim, only some 1.7 million kina to date. That's not good enough for them. We'll be having a meeting today. We've identified the funds, and we can give them actually more than 5 million. I'll request him long end. That's the first point. We'll make him long end.
Thank you.
We'll make sure that that housing can pass. I'm on the important hospital lahap. Now they're doing a good job. Only the church health service la country Bloyomi. On the Catholic health services, they're running about 70%. The line Bloyomi staff, rural communities Bloyomi. Our government to make sure that they fully function. At the moment, only got 260. All workmen fully paid through the Alaska payroll system, never done before. So they're part of the 28 agencies under the Department of Health where we look at them long end. And to make this commitment to make sure we make the funding available as soon as possible. Second question, the member asked him long, Aussie Blow, Chihuahua Provincial Hospital, I'm fully aware of that. See that there's funding available this year. Next year's budget by Mr. Workload Design. 2022, there was funding of 15 million kina given to all the PNGs in the country. Because if you look somewhere, sometime of COVID-19, you will get less than 50 ICU beds. COVID-19 exposed many of our failures, weakness in the health system. Less than 50 ICU beds. Today, I can say today that we have more than 120 ICU beds in the country today. No more, less than 50. We have more than 120 ICU beds now. We've actually progressed since COVID time, it's coming up now. So this is a system that we are seeing. I'm making the point, Mr. Speaker, yes, we will fully support the Chihuahua Provincial Hospital to complement what the Nazarene Hospital is doing. It will be on the budget. As it's on the budget, then we'll make sure that we support them. Me appeal legal Chihuahua PHA, they have 15 million kina allocated long all by need to make sure that they only support him. It's an arrangement too. There's a land available. Long bands, I saw that place myself, and I'm glad I walk along and make sure that we'll deliver that place hospital for them. So, number 3 question, the health system failed or not? And referring to Sir Puga's question yesterday, health system has not failed. Suppose Yumi can deliver him successful operation kidney transplant this year, health system not failed. Health system not failed.
Honorable Minister, we have a point of order. The Honorable Member for Aba, what's your point of order?
Point of order, the Minister really has to accept the fact that notices have gone out from public hospitals saying that there's no money, no medicines, they are sending patients away. That has never happened before. Therefore, today, the system has failed.
Honorable Member for Aba, it seems that you like to debate on the question, and I would not allow for that. So, Honorable Minister.
I want to say today, health system has not failed. 3 weeks ago, we started sending medical supplies to the 5 AMS. That was my response yesterday. Now yet we look at Facebook also, no got margin, net stuff. Today, we are now receiving reports from our medical supplies team to confirm. Milan Bay, we usually sent 620 workers of medical supplies to Milan, example. That's an example. It's going right across. So it is up to the provincial pharmacist, hospital pharmacists to do their order, place their orders. You go along with the district hospitals to place their orders. As we speak, there's system there's a program going on as well to make sure that we beef up on our supplies too. So we are trying our best. 80% of the funding to PHs have been given. System not failed, Mr. Deputy Speaker. We are having control of our system. Can you just sit down and I continue to talk, please?
Yeah. Sit down. Honorable Minister, we have another point of order.
Needs to come out a little bit clearer. The system has failed. He needs to overhaul the system. Why the deliveries and why the deaths are happening, why the hospitals are closing, that simply shows that the system has failed and he needs to overhaul the system. Thank you.
Honorable Minister.
Take it through Myanmar's law, like it's a very, very vibrant topic and debate that we are doing. We go to Amundi Takikia. There's a level 3 fully functioning housing where you got doctor now is Tablohab. You go to Mohead today, there's a doctor there. So 3 hours flight from here to Mohead, there's a doctor there, the private healthcare facility. You go today to Lake Kobiago, you got housing in the building lab. You go to Koroba, you go to Kolosta, there's a hostel now, Stablohab, doctor by Stablohab too. So you go to Gaulim, there's a system, but the primary healthcare level, we've actually forgotten about this in the entire system for so many years. We are revolutionizing primary healthcare for the first time.
Good one.
For the first time. We have support with the DFAT and ADB. And as you see, just go to Bogia. There's an infrastructure level 4. Next year, January, you guys come to Pomio district and see the first level 4 greenfield in the country for the first time. I'm not saying this is the Minister for Health. It was there. So at a higher level, Mr. Speaker, next year we will deliver Kimbe, level 5 hospital. Next year we'll deliver Hela, level 5 hospital. All of these are now in the system to actually deliver them. Central Provincial Hospital. Okay, PNG, this laya. Ongatamari look at the newspaper, Mr. Speaker. This laya, you may successfully deliver 2 kidney transplant in the Papua New Guinea system, health system. Is the system failing or not?
It's working.
At the moment, 2,000 line is supposed to go to Australia long heart problem only go long cat lab system lo yumi long health facility na. They're saving more than 200,000 one line supposed to go to have. System not fail, Mr. Speaker. We will deliver the first state-of-art cancer facility by March next year at PMGH for the first time.
Good.
And system fail or not? You talk about system lo health, you talk about human resource. This year alone, government put in 3,000 workmen more into the health system lo yumi. 233 million kina. Our government gave them PE. Longer than 21 PHs, we delivered 3,000 for the first time. Yes? And then we have a standalone medical university for the first time. We are now declared Vienna Convention also qualified to actually treat people with radiation in the country under the International Energy Atomic Agency for the first time in our country. All of these are happening. Sometimes must give credit where it's due. All the members of parliament, you need to sign a service level agreement with the PHS to support them where they actually test weaknesses to. We have funding to support. We have 80% funding given this year, and we're going to support them. Yes, system, it's a system for health, HR, medical supplies, procurement. All of these are part of system. Human resource staff.